Hello, I'm Emma Louise Coffey and welcome to The Dairy Edge, the Teagasc Dairy podcast. We're bringing you the latest information, insights and opinion to improve dairy farm performance. On this week's episode, we're focusing on udder health and the importance of maintaining low somatic cell in our dairy herds. I spoke to mastitis expert and dairy advisor Don Crowley, who had some great tips and advice, and he first explained what high somatic cell is an indicator of.
Fundamentally, a high somatic cell count is an indication of the level of infection that's inside that cow or in that particular udder. Within a cow with a high somatic cell count, it will predominantly affect one quarter. So when we're dealing with somatic cell count, we need to identify then which bacteria then is causing the problem, which gives us the indication of where this problem then is coming from. And then we can line up our source of attack then after that.
What would be the most common infection that we'd see within Irish dairy herds?
I suppose predominantly the Staph aureus would have been the number one bug, bacteria that would have been seen and cultured. But in recent years, the level of Staph aureus has dropped in the national herd because through culling and through very good work but there has been an increase in Strep uberis within herd. We'll find some E. coli, Streptococcus galactia and Strep galactia, but the two predominant bugs would be Staph aureus and Strep uberis, which would be the predominant in the national herd.
And in terms of Staph uberis, what is negating this and how is this appearing in the cultures?
I suppose Staph aureus has been predominantly a contagious bug. It's a cow-associated bacteria, so to spread from cow to cow in the milking parlour. And I suppose in the quota area, we had been keeping on to a lot of these chronic type cows, which were passing infection on during the milking process. Now that we are in the expansion phase, there's been a good bit of culling, a lot of heifers coming in. There's been more move to this Strep uberis, which is an environmental type bacteria. And the main areas that lead to this is the environment with which the cows live in, which is the limiting factor is a lot of houses are overstocked, causing an environmental pressure on the cows. And as somatic cell counts reduce, they seem to become more predisposed to a Strep uberis type mastitis.
If we just consider where we are at the moment, we're in the first few weeks of lactation, really. What sort of somatic cell levels are we seeing on farms directly after calving and in the first few weeks of lactation?
So anyway, we're seeing big variations. In general, the somatic cell count at national level is very, very good. Like with Animal Health Ireland's work and Teagasc's work, there has been big improvements. But we are seeing big variations. And if there's a Staph aureus infection inside the herd, you will generally see cows calving down with a higher cell count. With a Strep uberis type infection, you will have a lower cell count but a higher incidence of clinical mastitis. And so you'd see low cell count herds, 100, 150,000, but could have a significant incidence of clinical mastitis. And the issue is they're seeing this mastitis, and picking it up before it gets into the tank. So it's not having an impact on the tank then. Whereas Staph aureus can be a subclinical mastitis, no clots, but a high cell count. So it can be more difficult to pick it up. So having a bigger influence then on the bull tank.
In terms of the higher level of somatic cell that we might observe on farms, like if we talk through the practices on farms at this time of year, what are the main contributing factors to high somatic cell? You mentioned the environment and the maybe higher stocked cubicle sheds, but besides that, is there any other main factors? We
have the stocking rate, as we mentioned earlier. The other thing is maintaining a good cubicle bed, clean, dry. The usual, which is very, very important. And using a disinfectant lime in it once a week will keep the bacterial challenge low in the bedding area. I suppose the other two areas to watch is the calving area, the calving beds, the calving area, communal calving boxes becoming more help. I suppose you'd see them more regular because they're a big help for labour, but they can contribute a lot more than to infection. So the use of internal teat sealer at drying off is a big area to mitigate against that. I suppose the big factor really is inside the milking parlour itself. The practices that are exhibited during the milking procedure at early lactation are crucial. If you're handling cows, you must wear gloves. Pre-spraying and dry wiping is a huge help to remove the bacteria off the teat before you apply the cluster. Disinfecting the cluster in peracetic acid after high cows helps greatly to mitigate against the spread, because an infected cow will spread it to the next 8 cows, next 8 rows through an infected liner. So an infected cow can potentially do a lot of wreck inside in the herd. And it makes a very good teat dip, post dip with high emollients, but put on properly at 15 mils per cow per milking. That's one big factor out there, farm level. The equipment for applying post-milking teat spraying is inadequate, and there isn't enough being put on, which to maintain good teat condition.
Okay, so in terms of the advice there, just to kind of sum it up a little bit, in terms of the cubicles and the calving units, make sure that the cubicles are adequately limed, the bedding in the calving area, is clean and I suppose changed regularly, and I suppose a particular emphasis on the milking procedure and the management of the Udder Health around that. I suppose then if we just move to the whole lactation for a few minutes, Don. In terms of the national dairy herd, has the level of somatic cell increased or decreased in the last, say, 5 years within the national herd?
There's been a dramatic reduction. I mean, to be fair, to the work done with Animal Health Ireland and all the advisors and everyone around, there has been a dramatic reduction. If you put all the milk into one pot and took the somatic cell count in the national herd is running about 170, 180,000, which is a fantastic improvement on previous. So there's been a steady reduction every year in somatic cell count in the national herd.
Just to interrupt you for a second, Don, when you're saying it has dramatically declined, can you give a figure? Have you an idea of, say, what it was 5 years ago? Or
the national herd would have been about 230, 240, 250 in around that time. So, there has been a dramatic reduction. Like, farmers have worked hard at it. They've culled, they've used the heifers coming into the herds diligently. Like, the fear was that expansion and culling would have been taken out of it, but they have used the heifers well and they've mined them. And I suppose it is one of the issues we have to mind going forward is our heifers coming into the herd, because there is a higher incidence of mastitis coming through in them, and we just have to watch them.
And in terms of higher somatic cell, there would be a link, and I think that research has shown a link between high somatic cell and lower profitability. Can you quantify that in a euro value term?
In general, the two main cost effects are coming. You're talking about, I think it's 1.2, 1.3 cent per litre for every 100,000 over 100,000 in somatic cell count. And that's made up primarily for every 100,000 you go over 100,000, you lose 2% in milk yield, in the potential yield that's in the cow. And the extra costs that are included in there are veterinary costs, lost milk yield, the lower lifespan of the cow, higher culling rates. And you're not reaching the full potential then of your herd because it's not maturing, so you're not getting the full output of those herds as they increase. So they're not hitting 4, 5, 6 lactations, giving that. And that's what this high somatic cell count is doing. These cows are leaving the herd earlier and they're damaging the milk producing tissue inside the rest of the herd. So it is a significant financial cost.
If we consider that 5,000 on a 5,000 litre cow, it works out at about €75. So that would be €75 for milk alone, which is quite significant. Considering it over a 100 cow herd, there's huge financial implications. When we look at the level of milk recording in Ireland, a lot of farmers are milk recording now. And if you consider Herd Plus gives a comprehensive report on all milk factors really, and somatic cell is one of those. What advice could you give farmers in terms of how they can use their report to improve udder health and somatic cell on farms?
I thought the first thing is that you have to do an early milk recording. Herd Plus through Animal Health Ireland are doing this cell check report, which analyses how your dry period worked. And the first milk recording must be done within 60 days of the first cow calving to analyse how your cows have done during the dry period. It'll analyse the cure rate, it'll analyse the new infection rate, and it'll analyse the infection rate of the heifers. So the first thing is that your first milk recording should be done within 60 days of the first cow calving. The other thing is the early milk recording will identify these high cows. So at least you will help work them early to prevent them from spreading the infection to other cows. This case of waiting until all the cows have calved before a milk record, at that stage there's too much damage done. So I would be thinking for the majority herds, they should be trying to get their first milk recording done by the 15th of March. and analysing that cell check report sheet to look at dry cure rate, new infection rates, and look at the heifers. That's crucially important.
Can we just rewind back there? You mentioned if we milk a cord within 60 days, we can identify the cure rate. Can you just explain what you mean by that, Don?
So basically what this is doing is looking at cows that I dried off at over 200,000 last autumn. And what percentage of them calved down under 200,000 this spring? The cure rate should be 85%. And it looks at the new infection rate as well. So the cows that I dried off at less than 200,000 last autumn, what percentage of them calved down over 200,000 this spring? That should be less than 10%. And it also looks at the heifers. What percentage of my heifers are calving down over 200,000? And the target is that they should be less than 15% of my heifers calving down over 200,000. And they're very good parameters, and they're great benchmarks to work your hard off of.
You've been to a lot of farms, and you've looked at where somatic cell is very low, but you also look at farms that have chronic somatic cell problems. Based on what you've seen, what advice can you give farmers to maintain a consistently low somatic cell across the year? What are the practices that make farmers good in terms of animal health?
It's the little things in it. It's changing the liners every 2,000 milkings. It's wearing the gloves, good post spray, making sure the liner, watch the infected cow. Don't underestimate the impact that she can have, in particular to low cell count herds. When cows get mastitis, you need to disinfect those clusters after, or else segregate her until last and treat her right. And if you're going treating them, treat them hard and treat them early. And early identification is very, very important. But it's the little things that make the difference. It's like running the scrapers every 3 hours, 8 times a day, especially now in this area with the amount of cows that have calved. It's the little things, but early intervention is the crucial thing, and preventative measures as much as you can.
Finally, Don, farmers are selecting bulls for the upcoming breeding season at the moment. If they were to focus on, say, mastitis and low somatic cell in terms of the genetics of their cows, is there anything that you would advise them to focus on within the sub-indexes of the EBI?
I suppose the three things that I look at when I was looking, that I would be saying to farmers, you have to look at the health index inside this. You must have positive health index. It's built on somatic cell count and mastitis, and it's built on lameness, with the predominance being the mastitis bringing up the big percentage inside in that index. And like if you look at Dunnaberry's work, the health index is going to be the way forward from maintaining the herd. The second thing is I would look at milking speed. Be very careful of putting free milking bulls on top of free milking cows. I'm seeing a lot more incidents of mastitis in heifers due to the openness of heifers. And the third thing is to look at teeth length. Just be careful of short teats, hard to milk out, heifers holding onto this milk, then getting this environmental mastitis. They're the three parameters I would be looking at. Temperament follows a little bit, but that generally sorts itself out. They're the three I would be looking at.
That's great. Thanks very much, Don.
No problem, you're welcome. Thank you.
That's it for this week's episode of the Dairy Edge podcast, and my thanks to Don Crowley for joining me on this week's show. Don't forget to subscribe on Apple Podcasts, and for more information go to the Teagasc website at teagasc.ie. I'm Emma Louise Coffey, and join me next time for your Dairy Edge.